Hi, everyone. So, Matilda and I are going to talk to y'all about existential therapy today. I like to sum it up as a meaningful life with responsible choices. Okay, so I'm just going to run down some of the key tenets for you. Um, so, these are some of the key tenets of existential therapy, and don't let them depress you before I explain them. So first, life is inherently meaningless. That means that there is no just like one true meaning out there. This is what this existential therapy believes. We create the meaning in our lives. So all of the meaning in our lives is subjective, which means that we get to write the story, we get to create the meaning in our lives. We are born alone and we die alone. So that gives us anxiety, and that's okay. That's like a normal human reaction to that feeling of aloneness. And it can motivate us to make our life count and make meaning in our lives, make our lives meaningful. Okay, so meaningful choices are made when we acknowledge our mortality. I just kind of explained that one. Um, Anxiety and struggles are a human experience. Freedom is discovered when we realize we choose our existence. Um, and in our freedom, we must make responsible choices. So those are the key tenets. And following that, I want to just talk about the four givens in existential theory. So we've got death, freedom, isolation, and meaninglessness. Um, so all of those words seem, heavy. Freedom may not seem heavy, but when you think of like ultimate freedom, that like endless possibilities and every choice you make has a consequence, that can feel very disorienting and just like, what do I do with that amount of freedom? So some people have like unhealthy coping mechanisms, and in existential theory, we try to help teach the clients or help them discover what are going to be the healthy responses to these four givens in existential theory. So I have some listed here. Um, in the face of death, in the face of that existential angst of I'm gonna die one day, we're all gonna die one day, a healthy response to that would be having faith or a belief in something greater than yourself. These are kind of like antidotes to these existential issues. For freedom, it would be responsibility. Um, so instead of just kind of going crazy and doing whatever, choices and not really thinking about the consequences, you find the responsibility in that freedom. Um, for isolation, I put love. That could be anything. That could be relationships with friends, family, significant others, a healthy reciprocal relationship. And then for meaninglessness, I put a healthy response for that would be creativity. It's really about combating meaninglessness with meaning. So finding what you're passionate about, what is your purpose in your life, and making your life about that. It's something that Frankel really believed in. And so okay, I guess I'm ready for the next slide. Yes, and sorry, this is perfect because I wanted to just include a little quote from Viktor Frankl's Man's Search for Meaning, which was so Viktor Frankl was the founder of existential theory for counseling. And he wrote an amazing book called Man's Search for Meaning. And so here's a quote from it. It says, in some ways, suffering ceases to be suffering at the moment it finds a meaning, such as the meaning of a sacrifice. So it's like finding meaning in suffering. So suffering is inevitable. That's kind of like a Buddhist thought. But we can find meaning in it, and you're able to, it was Viktor Frankl's philosophy that you could survive almost anything if you had meaning. So, okay, the next slide. Okay, so for this presentation, the population that we're studying is a female, 35 years old. Her name is Matilda. She is divorced and she's a mother of one. She struggles with substance abuse, substance use disorder, and she is in active addiction to alcohol and prescription medications. She recently lost her job and custody of her child. She grew up in a family that had substance use issues. She states that everyone in her family drinks. It was just, she kind of said it in a flippant kind of way. So we'll talk about that. She's not religious, but she's spiritual. She's currently living with her parents who are also in active addiction. And she has been court ordered to seek substance use treatment for the custody court case. And so that's why she's coming to us today. And this is a cool little drawing because it's Jean-Paul Sartre, and he was a French philosopher who came up with existential philosophy, and that's who Viktor Frankl pulled, some of those ideas from his philosophy. And so this is a cool little drawing of just kind of like human behavior and responsibility and all that. Okay, so some techniques we will be using today are psychoeducation about existential theory. It's really important to educate the client in like the kind of theoretical base you're going to be working from. We don't assume that the client is going to have any knowledge about, counseling theory. And so psychoeducation is pretty important, especially with existential therapy, because there's certain terminologies that we just want to make sure they're aware of before we start speaking in that language. Phenomenological perspective, which just means showing empathy and a deep understanding of the client's perspective without judgment. That's really important because it's really important in the existential theory to create, a client and counselor bond, like a really strong relationship that we can work from. And then that sets the stage for the confrontational questioning. In existential theory, we are not afraid to be confrontational with our clients. It's obviously in a constructive way, but we want to be confrontational because we want to, like the next technique says, we want to stress the importance of authenticity in their lives and show them that the choices they make, if they want to be authentic, they should reflect who they want to be. And so those are some of the techniques we will be utilizing today.
Okay, so now we're going to kind of get into the efficacy of the existential approach towards substance disorder treatment. So something that I just want to highlight is based off of those key tenets that we're looking at. So like depth, freedom, isolation, meaningfulness, like these are all issues that people initially in the recovery community are often, or trying to transition into the recovery community, are dealing with. So this idea of freedom, of what can my life be? What resources can I utilize? I think we're looking at different ends of the spectrum too, with individuals dealing with substance use disorder, individuals who are houseless, or individuals who may have different privileges. Those would be different scenarios. But also isolation. Substance use often isolates the individual. They often put meaning in their life as using, or my purpose is to drink, my purpose is to use. And so something that is discussed in the recovery community is their higher power then becomes their drug of choice. And so looking at this from an existential approach, finding higher power or something to believe in outside of themselves is a powerful part of why this can work. So I just quoted here, existential therapy may be used most effectively when a client is able to access emotional experiences or when obstacles must be overcome to facilitate a client's entry into or continuation of recovery. So to get someone who insists on remaining helpless to accept responsibility. So that's a big part of individuals who are in the recovery community, coming to terms with sobriety and things like that. In 12-step programs, we hear this reference. So coming to terms with the responsibility for the behaviors that they had during their active addiction, forgiveness of themselves, asking others to forgive them, and things like that. So the existential approach has been shown to be effective in working in short-term substance abuse treatment. So this is a brief approach. Oftentimes this is a pretty powerful approach in fresh recovery and things like that. So helping individuals out of detox. So once an individual is able to out of crisis and they're able to think about where they want to go with their lives, what do they want, those kind of things. So the existential orientation is particularly suited to individuals who are experiencing a lack of sense of identity. So who am I? What does my existence mean? That occurs in the cases of substance abuse and alcohol addiction. So existential therapies can penetrate to a deeper level of issues related to substance use disorders, often serving as a catalyst for seeking alternatives to substances to fill the void the client is experiencing. Because oftentimes substance use is a coping mechanism for individuals because they're utilizing unhealthy coping mechanisms because they don't have healthy ones to use in that place. So we're going to kind of consider the cultural considerations here. So the cultural considerations of the recovery community, individuals dealing with substance use disorders. So it is an important part of existential therapy to be working off the social and cultural worldview of a client. So that is the role that the existential therapist plays. And so because they are highlighting these things, there becomes an increased awareness of the pervasive discrimination, sexism, racism, that helps the client manage how to respond to such attitudes and behaviors. So it can be helpful in addressing discrimination and stigma that individuals in the recovery community do face. And then this acts as a key component in how the client makes sense of the world, since it is the role of the existential therapist to understand the worldview of the client, help the client navigate how to make sense of their struggles they may face as part of their social and cultural world. Some of the limitations that we're seeing are that the existential therapy has potential to perpetuate Western dominant values that have traditionally served to marginalize culturally diverse clients. So some of the limitations that we're seeing here are with intersectionality, and another note here is that individualistic orientation contradicts group orientation versus collectivist. And then because this approach attempts to address the underlying factors of substance abuse disorders, it may not always directly confront the abuse itself. So we are addressing the reasons why an individual may be using this as a coping mechanism. So it is getting to the root, but in some situations, we're not necessarily addressing the physiological symptoms of the substance use disorder. And so then we have this lovely little picture right here. This is often a question that existential therapists will be asking their clients: what gives your life meaning? Who do you want to be? What are your hopes? Those kind of things. So got our references here.
Okay, great. And so I think we're going to move into our therapy session.
Okay.
And maybe, I think you can stop sharing the screen.
Okay.
And it'll just be us, is what I'm thinking. Okay, cool. So I'm just going to jump right into it if you're okay with that.
Yeah.
Okay, hi.
Hi, how are you?
Hi, I'm doing really well. And you're Matilda?
Yes, I'm Matilda.
Very nice to meet you. Thank you so much for coming in today. I really appreciate you taking the time out. I wanted to know if you've just ever heard of existential theory, therapy, existential philosophy, anything like that. Does that sound familiar to you?
I have practiced yoga before and I have heard of some of these principles, but it's not something that I'm really fully educated about. So I'd love to hear more.
Okay. Oh, that's great. So, existential therapy has some ties to some some Eastern philosophies. And so the fact that you've practiced yoga, I mean, some of these thoughts may seem familiar to you. One of the main things we talk about in existential therapy is the meaning in your life. And so we're going to be talking a lot about that today. I'm going to want you to reflect on what you find meaningful in your life or what you would like to find meaningful in your life. I'm going to ask you questions about, like, if, let's say, a hypothetical, if someone were to write a book about you, what would the book say? Um, then we're also going to talk about, in existential theory, there are four givens. So death, isolation, meaninglessness, and freedom. We can expand on those if you would like, but um, it is in human nature to kind of have these worries about things surrounding death and isolation, being alone. We're born alone, we die alone. This is a very human thing. Um, we all deal with these in different ways, and some of us have, what you would call healthy coping mechanisms. Sometimes we have a combination of healthy and unhealthy. Some we've learned from our parents or significant others, and maybe they're not serving us as well anymore, and so we need to change them um, to live our life in a more authentic way. So then that's something else I want to tell you really quickly, is the living in an authentic way. So you think about what you want your life to be, okay? You think about the meaning in your life. It's subjective. You get to create it. And then we kind of work backwards and think, okay, in order for me to live this life, what are the choices I'm going to make? Okay, is this all making sense to you so far?
Yeah, I think this makes sense to me. I think some of the things I'm thinking about is that I kind of don't know where I'm at right now. I'm in this point in my life where things just didn't work out like I thought they were going to.
Mhm.
Feeling pretty alone. I mean, I'm a 35-year-old woman and I'm living with my parents again. I thought that I'd have my career going for me. I thought I'd still be married. I thought my child would be together, but none of those things are reality for me right now. So I think
Mhm.
I've been having a bit of a pessimistic view of the world as
Mhm.
of recent.
Okay, so what I'm hearing is you're saying, you had a view of where you thought you would be at this point in your life. And I would like you to expand on that a little bit more, and maybe tell me, what is the view you think where you were going to be at this point in your
Mhm.
life? What is kind of the ideal place in which
Mhm.
you would see yourself?
So, I got married young. It was a bit of a unhealthy relationship. We ended up getting a divorce a few years ago. We had one kid together. She's in her teens now. And, she definitely witnessed the fighting as she was growing up, you know, drinking in the home. It's something that I grew up with too. So I understand how that really affected her. Um, and in the same sense, it happened again. And
Mhm.
then, after I got a divorce, I got pretty depressed and I started using prescription medications that I
Mhm.
was receiving for a surgery that I had a few years back.
Mhm.
And then from there, job performance kind of went down. This isn't a job that I've like ever felt passionate about. I had to get a
Mhm.
job early because, I got married. I had a child when I was pretty young, and you know, work didn't matter to me anymore.
Mhm.
Um, my daughter only wanted to stay at her dad's house, and then
Mhm.
things got bad for me. And I think the question here is where I'd want to be, and I think where I want to be now is different than where I thought I'd be because I don't want to be married to that man anymore.
Mhm. Mhm.
Um, but I want to be happy, and I want um, to feel like I matter and that people want to be around me.
Mhm. 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 Okay, and that sounds like a lot has happened, and I just wanted to make sure I'm understanding you correctly. So I noticed one thing you said about growing up in a home where
Mhm.
people drink, and then the home your child grew up in ended up being like the home you grew up in. Am I
Yeah.
understanding that correctly? Okay.
Mhm.
And so are you feeling like that was almost inevitable, or how does that make you feel when you think about the parallels between your home life, how you grew up, and then the one you created for your daughter?
I mean, I think growing up, I didn't necessarily realize it was a problem. I think um, toxicity was my normal. My parents were very volatile with one another. The relationship that I entered with this man that I thought was perfect, that we loved each other,
Mhm.
ended up being pretty volatile as well.
Mhm.
And I had always drank. He had always drank. And I think as the relationship started to crumble, I started to lean on the alcohol more.
Mhm.
And in many ways, I was being selfish because I wasn't always thinking of my daughter. But having a daughter at an early age, there are some parts of me that didn't feel like I could be selfish when she was younger.
Mhm. 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 Okay. And so do you see this is going to be kind of a confrontational thing. Okay. And when I say confrontational, I mean it with the intent to help you. Because what I'm hearing with your whole story, I'm hearing so many opportunities for you to make other choices, which is great because that means more possibilities for you. And
Mm-hmm.
that gives me a lot of hope. And I'm hoping that along this journey with our therapy, you'll be able to see all the other avenues that you could take, all the other choices that you could make that then, um, get you one step closer to reaching, your most authentic, like your highest level self, Um,
Mm-hmm.
and so we can think of, like what have been your thoughts on stopping drinking? Is that something that you're thinking about currently? What are the steps you've taken?
I think I'm at a point where I know something has to change. I'm not happy where I am. I'm living with my parents again. I have this immense amount of guilt surrounding
Mhm.
the relationship with my daughter that um, is my fault.
Mhm.
Um, and I understand the confrontation that you're saying is that, I had this relationship with my parents and now I'm perpetuating this with mine. And I think that is something that I would like to work through with her. And it's sad
And
because I don't realize until we're on
mhm,
the other side of it.
100%. And I did not mean to interrupt you. I just wanted to say that, yes, you can accept that responsibility.
Mm-hmm.
And it can also be a moment where you show your daughter, this is where we break the cycle. You know what I mean? You
Mm-hmm.
can be the one to break the cycle, and your daughter can see you taking on that role, because we all make mistakes. We all, you know, in one way or another, try to fill these holes of, the fear of death, the fear of isolation, the meaninglessness, unlimited freedom. We fill them sometimes with food, sometimes with alcohol. I mean, bad relationships. And it's so brave to acknowledge that and make a change, and I just think that that's very admirable. Um, and it's good that you can accept that responsibility. I don't want you to like stay in the guilt for too long because I want it to be a productive feeling, like a forward momentum kind of feeling. So the guilt is there for a reason, but like, we're gonna take it. Okay, so we're gonna make a plan. And
Okay.
that sounds good. So we've got a plan for the drinking. I have a couple resources for you maybe at the end of the session
Okay.
we can
I
talk
can get
about. Because having people around you, I'm also kind of hearing in your story that a lot of the people closest to you, um, aren't really there right now. So your daughter, you want to get custody back of her, and so she's not there for you. So it can be very easy to feel isolated in this moment. You're kind of in this transition period. And I want you to have a group that you feel like is supportive of you and what you're going through. So I'm going to recommend something at the end of our session, and I think some group therapy will help in addition to individual therapy with me.
okay.
Okay, and so I just also wanted to say a little something about existential therapy is usually brief. And so it's not going to be like a multi-year kind of
Mhm.
situation. I feel like for someone like you, it's perfect because it's like this is an attainable thing. We can have a short amount of time with these amount of sessions. We tackle all the four givens, and so we find ways that you can cope with those in a healthy way. We find your subjective meaning for your life, and we come up with a plan. And so I don't know if you wanted to elaborate any more on kind of your situation, or now that we've been talking about meaning so much, has anything kind of popped in your head when you really think about like, what is the meaning for my life? What do I want my life to mean?
Yeah, and I think for me, especially, so in our custody case, this was court mandated for me to seek substance abuse treatment.
Okay.
And so coming to terms with that, I'm not just here because I've been court mandated. I also want to be open to this experience because I do think it's an issue. If my daughter thinks it's an issue between us, because at the end of the day, the true meaning to who I am is I'm a mother, and I care for my daughter, and I'm a helper, and I don't feel like I found meaning in a career and things like that. But the love and connectedness that I have to my daughter is really a driving force for me.
That's beautiful. I love hearing you say that, and seeing your face light up when you talk about your daughter. I can tell that that is very meaningful for you. And talking about finding a career as a helper, I can relate to that as a counselor. But I also like to think about when people go through struggles like you have, they can offer so much hope and help to other people who are maybe in the beginning of their journey on recovery, or in recovery. And so there is a group that meets up in Austin, and they are called Recovery Dharma. I'm pretty sure. I wanted to give you their name. Yes. And so taught speaking to you, like, you liking yoga and the Eastern philosophies and everything. And with us practicing existential theory, I think the Recovery Dharma is going to fit in perfectly. So they have groups that you can meet with. If you're open to it, I will give you that information. And I think that you will get a lot from the group, but you will also give a lot to the group because your experience matters. And I think that connecting with other people and finding a way to nourish that meaning in your life, which is helping other people, and then also your daughter. I think this is a really good start. And I'm just so grateful that you have let me be your therapist for this little amount of time. And I look forward to seeing you again in the future. How does that all sound?
I think that sounds really good to me. I think I'd like to get connected with other people in the area that are struggling with the same things.
Okay, sounds good. I will send you an email with all of those resources, and we will meet this time next week. Thank you so much,
Thank
and
you.
have a wonderful week. I can't wait to hear about how everything goes.
Okay, thank you so much.
Take care. Bye.